West Africa's fight against Ebola is stepping up a notch. Sierra Leone's President Ernest Bai Koroma announced a tough anti-Ebola package. Under it, he said all epicenters of the disease would be quarantined. House-to-house searches would be implemented to trace Ebola victims and quarantine them, and new airport protocols have been established. The measures resemble those taken by neighbouring Liberia, which on Wednesday announced the quarantine of a number of communities and the closure of schools across the country. Koroma also cancelled a visit to Washington for a US-Africa summit next week to hold an emergency meeting with regional leaders in Guinea on Friday. So far, about 700 deaths have been blamed on Ebola in Liberia, neighbouring Guinea and Sierra Leone, according to the World Health Organization. But medical charity Médecins Sans Frontières says the fight against Ebola in Sierra Leone is being hampered.
In a moment, as MSF, we only have a capacity to work in the case management centers, and we don't have a capacity to go outside. The situation is quite difficult. I would say we are on the top of the iceberg in a moment because the contact tracing is not really functioning, and this is one of the major issues what we have, because to find the patient as soon as possible and to refer them to the case management center, it's the basic for an Ebola outbreak.
The contagious disease, which has no known cure, can kill up to 90% of those who catch it.
To deal with this every day, to look people in the eye, you can see they are scared. To look over this fence right behind you now and look at the patients, and you know that their chances are very small. It's horrible.
Weak local health systems are struggling to contain the disease despite international help. And like many countries around it, Côte d'Ivoire is worried about a possible Ebola outbreak.
Donc, il y a un risque réel de propagation chez nous.
We know that we share borders with affected countries, so there's a real risk of infection spreading to us. This situation is worrying, and we're making available all necessary means to prevent the infection coming into our country.
Nous ferons en sorte de l'endiguer et de la contenir.
However, Côte d'Ivoire says it has put everything in place to be able to deal with a potential outbreak.
Surveillance épidémiologique, renforcement.
Firstly, we must make sure there's epidemiology surveillance and reinforcement of health checks on the border posts, putting in place a system of taking charge of patients. Then, protection measures for healthcare personnel. You know that health workers are on the front line of this battle, so we need to put at their disposal all the protection equipment necessary.
Pour pouvoir les protéger.
While the World Health Organization has stopped short of recommending travel restrictions, Togolese airline ASKI has already suspended flights to and from Sierra Leone and Liberia. Clementine Logan, CCTV.